Hey everybody, wanted to make a pretty simple video just discussing my top pros and cons with home health. Um, if you haven't watched my previous videos, I have been a home health physical therapist for about 2 years now. I've been in the profession for about 3 years and just wanted to make a video just discussing from my point of view now that I've been doing this profession for about, or this setting for about 2 years, really what the main pros and cons are of home health specifically, and maybe compared to other settings. So I'll start as many do with the pros, and then we'll look at some downsides. So probably one of the first main benefits as to why clinicians decide to do home health is the autonomy. Basically, you are an independent, and this kind of gets into the last point too. You're basically an independent practitioner. You're in the environment completely by yourself. There's nobody around to tell you what to do. There is nobody even in the vicinity watching what you do, or maybe potentially like criticizing you or judging you on what you do. So it's entirely up to you. You control pretty much, you control the whole session. The only person that can potentially, alter or try to control the way you work is either the patient or the family member. And if one of those two things is occurring, then you may have to have a talk with them that you're the one in charge, you're the professional, and not them. I've had to have times where I've had either, usually not as much the patient, but the family members that like to be a little nosy. And so that's just one thing to kind of, you sometimes have to deal with that. But otherwise, really, the autonomy is a really great thing about home health. You make your own schedule. You decide when to start working, when to be done working, and it's very, very flexible. That is the one, probably the single number one best thing about home health. Following up on that, one-on-one care, you really don't see this often in a lot of settings now, especially outpatient, where they want you seeing two or even like three patients every hour. It's just insane. Um, and I think it's just bad practice. It's just so nice just having only one patient that you're seeing every hour. And I think that's how it should be. Unfortunately, in some settings, it just doesn't allow for that. But fortunately, with home health, you can. So there's that. The other really kind of stemming on the flexibility is kind of like the work-life balance. I think home health provides a very good work-life balance. You don't have to show up at 8 in the morning because let's face it, most patients don't want to be seen at 8 a.m. or 9 a.m. Like it does with outpatient physical therapy when you got to wake up at the break of dawn and then get into the clinic and then like leave your house by 7:30, get into the clinic by 8, and then you're just up and running by 8 in the morning. And with home health, you can wake up at 8, you can wake up at 9. Heck, some days you can potentially even wake up at 10, and you don't start your day till like 10 or 11. If you're a night owl, home health is amazing because you can just start your day later and nobody is going to say anything about it. It's totally up to you. The next probably really big thing, and this is the reason why I switched to home health, is the pay. Uh, Hands down, I think, barring few very limited exceptions, there is no better paid setting than home health for a physical therapist. Potentially the only two exceptions are possibly some very seldomly found high paying travel gig. You probably have to relocate to a high cost of living area, and it probably for an immediate need. It's like some really kind of specific situation where you would be paid a pretty large amount of money. Um, Home health typically takes the cake. And the other, again, only small exception, but that's kind of hard to work up to, is like being a um, multi-location clinic owner. You own either one large clinic that sees like 30, 40 patients a day, or if you own multiple small clinics, then you might potentially be making more than a home health PT. Generally, though, that cost of entry is very high, and the amount of work you're technically doing outside of being in the clinic is also very high. So honestly, home health probably one of the, if not the best setting for physical therapists. And again, I kind of already mentioned independence. So that's what I really, really like about home health. If you are looking to do home health, I strongly consider it. I think it provides a overall, to summarize, it provides great work-life balance. It has very, very good pay compared to the other settings that you might be used to, such as outpatient or even acute. And it's just all that combined, I think it's very hard to at least not try it. Now, the cons of home health. Number one, driving. You're going to have to drive. If you do not like driving, or if you live in a very urban area where there is heavy traffic, this is a big downside. And especially this is largely dependent on your coverage area. That's one thing I would strongly suggest if you are interviewing for home health agencies, or if you are considering switching to home health. Absolutely ask them what is the coverage area, because if they're going to have you covering like 25 square miles or like 30 square miles, that's too much. Way too much. You're going to have to know how far you're driving, because here's the problem. If you have to drive 25, 30 minutes between patients, that is going to severely affect your earnings potential. Fortunately, I am with an agency that I only have on average maybe 10 to 15 minutes drive time between patients. And the patients I see are very clustered in a very small area. Um, so I'm pretty fortunate to be in that situation. I know, depending on where you live, if you're in a rural environment, you might have a much longer drive time between patients. And that is just kind of the reality. Um, so driving is definitely one con. Second big con about home health is documentation. This is unavoidable with any setting, but it's a bit exacerbated in home health because um, primarily with start of cares. Start of cares can require up to 30 to 45 minutes of documentation just for that one visit. And typically, for many other settings, you might only need to document 30 to 45 minutes for the entire day. And so let's say if you have a really rough day and you're doing like 2 start of cares in one day along with like 3 evals, that's a rough day for home health. You're going to have like 2 hours of documentation to do, and it's rough. But that's just kind of the reality of home health. If you don't like heavy documentation, or at least if you don't like to take home documentation, that is definitely something to kind of consider. Personally, I think it's worth the pay, because the way I structure my day is I typically do visits for 4 to 5 hours, and then I spend the additional roughly 1 to 2 hours documenting. Usually, no, well, usually I'm doing more than 4 hours of visits. Usually I do either 5 to 6 hours of visits, and then I spend about an hour, hour and a half documenting. So documentation's a big one. Be very mindful that you will have to document quite a bit in home health. The third one, this one is kind of dependent on your personality. A lot of people, and this can either be a positive or a negative, so maybe this kind of goes more in the middle, like I did with work environment over here. But I, you're pretty isolated. You're not gonna run into coworkers often. You're not gonna be able to chat and mingle with coworkers, or share and vent your frustrations or your thoughts or your opinions about patients. Generally, it's a pretty isolated environment. The nice thing is you still will do a lot of talking and a lot of communicating. It just won't be with coworkers. You will absolutely have some form of messaging platform that you're going to use to message your schedulers, your other clinicians, your other team members. But we're not, it's not like we're texting on those things and having like full length conversations. It doesn't go that way on online messaging. So that's just something to keep in mind. You're going to be isolated. And if you're one of those people that likes to work in like drama free, no kind of issues, no problems, then this might be a positive. So maybe this is a pro. But if you really like to, if you're a social butterfly, if you like to talk to people, if you like to kind of, this one might be a con. Now here's the interesting one: variable income. If you are pay per visit in home health, your income will be variable. Um, so you might, it's kind of an ebb and flow with home health. For me personally, I am busy most of the time, and my income is relatively steady because usually my agency keeps me pretty full and pretty busy. If for whatever reason I have a slow week, I would absolutely recommend to have a backup PRN agency, or doing some form of private visits, or having a private cash-based business on the side. That gives you a bit of a buffer, but maybe I'll get to that kind of in the future. But that just helps to kind of prevent this. But know that in the beginning, especially as you're building up your caseload, your income will be variable, and it also depends on the time of year. For instance, kind of like right now in the holidays, Thanksgiving, Christmas, New Year's, you might see a little bit of a slowdown, but it's all dependent on your agency. So that is just something to keep in mind. I know for me personally, my income per paycheck actually can vary by up to several $1,000s, depending on just how the week looks. Typically, it doesn't vary by that much, but my income can vary between $1,000 to $2,000 per pay period. So that might be seen as a con. If you really like steady, consistent income, you might not want to go pay per visit, and you might want to look at salaried. But I will honestly generally say that pay per visit still, annualized, usually beats out salaried. So just something to keep in mind, but variable income might be seen as a con. Uh, Work environment. Now, this is the interesting one. Basically, this can be seen as also either a pro or a con. But in home health, you're never going to have a, a same day. I mean, maybe unless you're seeing like completely the same clients every single week. But typically, as a physical therapist, you're going to be seeing different patients every week, meaning you're going to have different routes, different places you're driving, and different work environments every single week. Um, it's pretty crazy with home health. I mean, it's interesting. In one day, I can go from seeing a patient that lives in a $6 to $8 million mansion um, to heading over in the other opposite direction of the city and seeing a patient living in an RV trailer home. Um, so that is what I mean by work environment. It largely depends on kind of your area. That also matters too. You can go in really nice homes. You can go in really nasty hoarder homes that have insects, roaches, bed bugs. So that's just something to keep in mind. Now, here is the biggest con that I generally hear clinicians talk about, and oftentimes what makes many clinicians apprehensive about home health is safety. A lot of people, what drives them away from home health and from even attempting home health is just going into a stranger's home. Now, I understand where many people are coming from with this. Many people might find it uneasy to go into a complete stranger's home, not knowing what kind of mental state this person is in, what kind of, maybe they have weapons in the home. Also, there might be, usually, and I'll be very honest in saying this, usually the highest safety risk is typically from pets. There might be, off chance, some kind of aggressive dog, but that is typically your highest safety risk. Generally, this is largely overstated. Safety, or I should say over exaggerated. Safety is typically not an issue in home health. I might be a little biased. I am a 5'9" male and I weigh about 200 pounds and I have a very muscular built frame. So maybe I'm a little biased when I say that safety is not an issue, but here's some things to remember. First of all, this isn't random people that get admitted to the agency that just asked for a home health service. These patients that are receiving home health, they have to be referred by their physician for home health services, meaning that these aren't just strangers that you're seeing. These are patients that have some sort of medical ailment or medical condition, medical diagnosis that should render them homebound. And in saying that, they typically are very functionally limited. Generally, in my experience, I've been doing home health for 2 years now. I have never had a scenario where I truly felt that a patient posed a physical threat against me. That has never ever been the case. And likewise, to remember is you're there to help them. There's no reason that a patient or a family member should be in any way physically aggressive against you. There might be rare situations where, depending on the way the session is going. They might be verbally, I don't want to say aggressive, but more so, they might be displeased or dissatisfied by something, but in no circumstance have I ever had a patient be aggressive against me, physically aggressive. That's largely, it's an over exaggerated thing. Typically, again, the only threat is pets. Usually, if they're, I don't have issues with dogs. Usually, they're all bark and no bite. That's the way most dogs are. If there is an issue with the dog, usually the patient or the family member will know and they'll put the dog away, or you can ask them to put the dog away. But generally, safety is not a concern. If you're a female, especially like a petite female, you can potentially, if you want to be extra safe, you can carry like pepper spray, or you can carry maybe even like a taser. But honestly, I think that is a bit overkill. You probably don't even need to do that. Again, I have never been in a situation. There have been some situations where I felt a little uncomfortable being there, but I've never gotten to the point where I felt physically unsafe being in a situation. So this is largely over exaggerated, but it does seem to be really one of the biggest apprehensions for people getting into home health is safety. But again, in my experience, in 2 years of doing this now, I haven't had an issue with this. My personal main issue with there's one more I need to add. Can't forget that one. The last two are my two biggest cons with home health. Number one is difficult patients or family members, and number two is scheduling. Those are my two just like Achilles heel. These are two things I honestly just very much dislike about home health. If I had to put the number one thing, I would say my number one thing I hate is scheduling. Scheduling, I'm just gonna say it plain flat out. Scheduling sucks. When you're in home health, you are responsible to schedule a time to see your patients. Meaning, you are responsible for other patients accepting your availabilities to see them, because if they don't, your income will be directly affected by this. And what's really tough about scheduling in home health is that in every other setting, the scheduling is done for you. If you work in outpatient, on Sunday, you don't have to wake up and worry about, oh, who am I seeing tomorrow? If you work in acute, you don't have to wake up on Sunday and go start calling patients, asking them when they want to be seen on Monday morning for their physical therapy session. Unfortunately, with home health, you do. So the reality is, scheduling probably takes up, I want to say, about 2 to 3 hours of your week, depending on how busy you are. I myself typically see 6 to 7 patients per day, and scheduling probably takes up at least 2 hours of my week every week. What sucks about scheduling is generally agencies do not reimburse scheduling. Scheduling is typically baked into the visit rate, and generally calling patients to schedule is a part of your rate, your reimbursement. I personally don't like that, because I think that if you're waking up on Sunday morning and you're having to spend 1 to 2 hours scheduling, not doing visits, not seeing patients, not doing any documentation, I think it's wrong that time comes as part of your pay per visit rate. Fortunately, I work with an agency that reimburses 1 hour of that 2 hours. So I am fortunate to get at least some reimbursement for scheduling, but most agencies do not reimburse scheduling. And so what's difficult is you wake up Sunday morning and you might make 10 or 15 calls, and it just might be one of those off days where you only get 4 patients that'll answer and 4 patients that will accept your time. And then you try texting people, nobody replies. You leave voicemails, nobody replies. So that is just one big downside of home health that I think that's not talked about enough is scheduling. It sucks. I hate scheduling. The last one, this one doesn't happen often, but it does happen. You will get difficult patients and difficult family members. And the funny thing is it's largely not the patients. It's almost always the family members. It's generally never the patients because the patients are usually 70, 80, 90 years old. They don't know what's going on. They half the time they might not even know. Well, depending on their cognitive status, they might not fully even understand why you're here. But you know, many patients are at the point where they honestly don't care. But unfortunately, well, I sympathize and I understand, but unfortunately, sometimes you get very overbearing and just very, very rude and disrespectful family members. And for whatever reason, I have often found the case that it's oftentimes the daughters. I don't know why, but it's oftentimes if I ever get difficult family members, it's oftentimes the daughters that just cause a big headache. Typically, it's for one of 2 reasons. Number one, they are dissatisfied that they're being discharged, or number two, they are dissatisfied with the frequency and the duration of care. It's typically due to one of those 2 things. And it is annoying as heck to deal with them because you have to call them or talk to them in person, and it's generally not comfortable conversations. You have to explain to them why they're being discharged. They will start to butt heads. They will kind of say, "Oh, I don't understand. Why are they already being discharged?" They're like, why are you guys already leaving? Yada yada. It's an unfortunate part of the job. You can't always get around it. Most of the time, the great thing is 99 times out of 100, patients and family members will respect your time. They will respect your decisions. They will respect your, you know, you as a professional. But unfortunately, once in a while, you get the bad eggs. And it probably happens to me about once or twice a month that I have to call and have these uncomfortable conversations with patients, or again, usually the family members. But that's just the reality. That's part of the job, and those are honestly my 2 main cons. I would say that are actually the main cons are difficult families or difficult family members and scheduling. But the reality is for me, and the reason why I do home health is that it doesn't outweigh the pros. I think the pros are very much worth it. I love the flexibility. I love being able to manage my own schedule. I love that it pays quite a bit more than most other settings, actually, if not all other settings. So if you are contemplating switching to home health or starting home health, hopefully this video has given you some more insight as to what to expect and just more about the profession and the environment. I probably missed some. This is probably not comprehensive, but this should give a good idea. Anyways, I've been ranting or just going on for about half an hour, so I'm going to end this video here. If you have any questions or comments, you're more than welcome to leave it in the description, or the description, the comments below. I'll try to answer everybody that I can. If you have any questions, I'll answer as well. Thank you all for watching, and I'll see you guys on the next video. Take care.